I'm Dr. Tejasvi. I'm the senior consultant head of the department at Yashoda Hospital, High Tech City. We're going to discuss topic today was integrating a wellness perspective into an emergency medicine practice, which is topic uh, which required for the every emergency physician in day-to-day life. We work hard. We run through our daily routine. Patient care. We work hard. We don't take care of ourselves. So that is the most important aspect. I got the better expert who can deal with this and give us a better idea, better suggestions, and better take home so that how we can maintain our wellness as an emergency physician. Okay, not only as an emergency physician, as a doctor, as a healthcare provider. So, as come to the introduction for this as speaker, she's a founder and director for Skin Health from Kerala, and she's a grandeur aesthetics as well. And she's a fellowship in aesthetic medicine. She's the clinical dermatologist. Done the fellowship in emergency medicine as well. And she was my one of the old friend. We met very long ago, and we did our MBBS together. So it's been pretty long, and we're connecting live through today. I think I pass to the expert. She can speak on the wellness now. Shruti, over to you.
Hi, good evening, everyone. Thank you so much for your time, Dr. Teja. I have to tell you, it is my immense pleasure to actually be catching up with you again. But I think we'll keep our catch up for much later. I think we're meeting almost, we've known each other for 20 years now. So, but life has taken us through paths where we have decided our specialty. So, one of the reasons why, when Dr. Teja asked me why I was very interested in doing this, is because me as a practitioner, initially I did my fellowship in emergency medicine from KMC Mangalore. And I was practicing emergency medicine for a very long time. It is only much later that I did my fellowship in clinical dermatology and decided to switch over to the more happening and the more fun, newer field of aesthetics. But having practiced in both these sectors, when I spoke to Dr. Teja about integrating wellness into emergency medicine, as a practitioner, most of the doctors usually would definitely think of this as wellness in terms of the physician's wellness. But what I would like to sort of change your perspective here is that I'm not just talking about wellness in as far as the physician's concerned. I'm also talking about using wellness as a tracker in the emergency department. Now, this will be a little shocking for everyone because emergency department where nobody has the time for anything. We are a very time intensive a kind of a field where you have to make very quick decisions, where you're just the core and crux of emergency medicine practice is just stabilization and handover. Where then will you have the opportunity or the time to practice this whole new concept of wellness? So, one thing that we need to understand is as an emergency practitioner, as most of you would know, your emergency department is the face of the hospital. It is a place where patients come in and see you for the first time, where they experience healthcare for the first time, where they experience, everything that the hospital stands for upfront. As opposed to being in an OP, the time or there is hardly any waiting time inside an ER. So basically, everything they experience will put a mark on the institution that you're working in. So it becomes very important then that you make an impression from the word go. Having said that, in every Indian hospital, without fail, you can be one of the best and the most equipped hospitals in the country. You can be one of the very smaller primary or secondary centers somewhere in the rurals. But it is very habitual within our healthcare system that the minute an OP time is over, the minute the standard OP time in a hospital is over, the ER naturally becomes the next extension of an OP. How many of you have had to see n number of patients walk in with something like a cold, a cough, and a fever in the middle of the night? Whereas the same symptom can be treated very well if they see their physician or the concerned doctors during the daytime. So, considering this scenario, it then becomes very important that we don't just triage our patients. We should be able to find out what is the trigger or what is the reason they are choosing to come to the OP. I mean, to the ER as opposed to the OP. Now, this becomes important from a very, very statistical business perspective. The number of patients that you see in an ER, the number of hours that a patient occupies a bed, will determine the success of the ER, right? So whether it is a person who's coming with a cold or whether it is a person who's coming with something more acute, if you can just keep that away, this performance, that is your performance with that patient, will determine a statistical standard.
I think it got stuck.
Number that is. So space. Hello, can you hear me?
Yeah, we can hear you.
Right,
You're
right.
audible.
So what I was saying is, in order to, can you hear me, or am I still stuck?
We can hear you.
Yeah, super. Okay, so in order to make sure that statistically your numbers are in the right place, it is very important that you first start identifying the patient who walks into your ER, right? Whether that person is actually meant to be in the ER or not. So for that, the only solution that you have is add a few wellness-based, very effective questions into your practice with particularly these sort of patients. Patients who ideally shouldn't be in an ER, but who choose to walk into an ER. Sometimes we understand that it can be something like it's a very social trigger that might happen. They feel that being in an OP will increase their waiting time. So it is easier and faster to just come into the ER. Whereas if we are able to have one extra conversation with the patient and just spend some time asking them why they chose to come at this time, wouldn't it be better if you came during the daytime, because you will be able to have more resources, you'll be able to see better experts during the daytime. These kind of conversations will make the patient feel more heard, and once the patient feels heard, the patient satisfaction will also increase. And this will reflect in better compliance for a patient to walk into the OP as opposed to the ER, right? Otherwise, if you're just going to think about stabilizing and disposing the patient, then you're not exactly paying attention to the patient's actual issues, or the patient feels like they're just being treated like another OP number or another patient number, not as a person. So this is where the practice of wellness with your patients come into play. That is one thing. Having said that, not all diseases are things that may require a medical intervention. Sometimes certain things may just require some other psychological intervention. But understand that as an ER practitioner, your time is very, very precious. You should not be the person sitting and giving this person too much of your time, because then the patient tends to gravitate towards you. Even if their requirement is elsewhere, they will gravitate towards you and they will want to continue coming to the ER. This will also drop the stats in your hospital. This will also drop your performance stats. Why? Because as far as management is concerned, you as a person, instead of seeing, stabilizing and exiting so many patients, you're spending too much of your time with one patient alone, or maybe half the number of patients that you could be seeing. So where can you solve this problem? This can be solved only by good teamwork. Identify and make sure that you employ the kind of team that works well together as a system. You cannot be the only person doing everything in an ER. No. The person talking 2 minutes extra to the patient can be a resource other than a doctor, but somebody who is empathetic enough to have peaceful conversations with a person. It should also ideally be somebody whose time away from the main system doesn't break the system or doesn't break the systemic functioning of your ER. All right. So these kind of practical steps, and as the leaders of emergency departments all over the country or wherever you are situated, you will be ideally the people making these strategic decisions, making these strategic rules, or making these sort of strategies that help in the optimal functioning of your ER, as well as in excellent patient satisfaction. Now, having said that, if we come back to what Dr. Teja initially spoke about the wellness of the practitioners itself, three things that most ER practitioners have to deal with is early burnouts. The second thing is, of course, you have decision making. The load of decision making is much higher for an ER doctor as opposed to other specialty doctors. And also, a lot of sleep deprivation also comes into question. So unless and until you pay attention to your team, you will not be able to identify signs of early burnout. You will not be able to identify when a doctor is not performing at their optimum best. This will altogether reduce the efficiency of your entire team. That way, it's not just that one person who's losing, the efficiency of your entire team is being questioned, and that will also dip in the performance statistics of your team. So identify these signs early on. Whenever you have time, make sure that very frequent team meetings are done, because in team meetings, give them an open space to talk. to share and to let you know where they are struggling with so that you can give them the solution to that. There might be points where you struggle as well. Let them know that this is a struggle for you. Sometimes it might be something as simple as a back pain, but let them know, let your team know. You have to trust your team. Once you let your team know these things, the team will step in. People who are resourceful enough within the team will step in and make sure that that one pain point is taken care of, but it will not compromise patient care. Always, like I said, to conclude, I just want to say wellness within the emergency sector is not just about whether it is the wellness of the patient or the wellness of the doctor. You work as a massive team, and the entire team's wellness is important. And when I say the team, it is not just the doctors, it is also every other support staff who plays a pivotal role within that system. So, as a leader, as a person who handles such a big department or such a big team, I think you should not only be fine tuned towards identifying your patient's crisis, you should also be fine tuned towards identifying your team's crisis, because that is the most effective way forward. Now, I'm open to taking some questions, and if you want to make this into a discussion, also, I'll happily do this. Dr. Teja, what do you feel?
Great. Any questions you can put up on the chat box? Just wait for 2 minutes. I think no questions. I think we can continue, Shruti, if we can. I think we can just continue it off.
Right, right. So in general, this is what we're seeing. One of the latest trends that we're seeing is that India, as such, like I said in the beginning, is struggling to differentiate between an emergency and an OP. Dr. Teja, if you can add in your 2 cents about a possible solution to that problem.
I think this is where every department, every emergency department faces it. So there are a lot of people who comes in the night. So I think there should be an awareness programs where when to approach the emergency should be increased. So it's not like the only thing normal. We don't have any symptoms. Sometimes what happens. This is main reason we have found out in our daily routine practices. They got the jobs 9 to 6 or 12 to 8
Yes.
jobs. So where they have time only in the nights. So that is where they have coming.
Right,
So where they can set up some clinics at their companies, so where they can have review in the companies, that would help them out, and they can get
right.
prior appointments and get at the right time in the morning. That would be helpful to them.
Right. One of the things that while traveling in other countries, one of the things that I noticed is that ERs in most other countries follow a US-based system of practice, wherein an ER is not at all the most readily accessible place. Like a patient cannot walk into a hospital and just open the door and get into an ER. Instead, they are given a very long waiting line, and the triaging is done even before the patient enters the ER.
Yes.
This is done with an intent to make the most least important person, or when you triage the least acute patient, it's made to wait for a very long period of time, and that waiting usually is something that discourages them from choosing to go to an ER the next time.
Yes. And there's one more thing. What we have done is in the night time we have triage as well, and we keep a doctor and the triage so that he can write out the prescriptions so that he can only take care of it. So they'll not step inside
Understood.
here and waste resources and time.
Understood. That also is like a very smart way to do it. The problem is once night time comes is where we usually struggle with these problems. During the daytime, usually it is still a little better managed, considering the fact that most hospitals are fully functional during the daytime. But
Yes.
given a country like India, where emotions run very high, and at
Yes.
night, you cannot really say who's going to be the person who gets agitated or who's going to be the person who's going to make a big scene just for having to wait for too long. So, this is also a very tricky point which needs to be handled. And I feel that the only way, it's not that these sort of agitations do not happen in other countries. People do have their own yelling matches and shouting matches, but their security systems are so firm that the person themselves won't harm himself or herself, and the practitioners are also taken care of. So I think while we are handling an entire ER department and trying to firefight these kind of problem pain points, we often overlook the importance of support staff, wherein I mean people like security guards, people like your counselors who are there at night, people The triaging person needn't always be a nurse practitioner or a doctor. The triaging person, I feel that the team should also include a counselor who has the empathy to talk to the person and make them understand as to why they fall last in the system, or they are not exactly an acute case, that they're okay to come back tomorrow. And a similar system is also followed in the UK, where they have where the NHS system, wherein you can almost never meet a practitioner, or you can never meet directly the specialist. But then the problem with this is that, unfortunately, the lag is too much. I have heard about people who are only able to, when they go to a hospital, they're only able to meet a lower level medical officer. And for them to meet a specialist, the waiting time is usually even months.
Yes.
I don't think that is practically possible in our country. But even a phone based system of appointments can also probably, or a very good digitized system of appointments. Your voices.
Sorry, I think mine's got
Yeah,
disconnected.
yeah,
Sorry.
yeah,
Yeah.
yeah. Yeah. So, like I said, in India, because
I
we
think we
have
can't hear you, Shruti. I think your voice
oh,
is.
I think it's a technical. Can you hear me?
No, I think this is. Yeah, you can speak up.
Yeah, it's quite audible now. So again, India being whichever city or whichever part of the country we take, I think population is also something that we need to consider. The population is so thick and overflowing. I don't think we'll be able to put in too many systems into place suddenly. But one hospital making a good, effective change can be an example of similar changes that you have to first bring at least one change in your system and show that it is an effective change and show that it has results. Only then will other hospitals be motivated enough to take it up as a as a possibility. And I think that is the only way that you can continue and probably bring out a more efficient system wherein wellness is not forgotten.
Yep. I think that's a system needs to be created a bit. I think
Right,
so a few simple practices which can be inculcated. As I said, we need some team support. So most of the emergency departments where we only have emergency physicians, emergency nurses, they don't have the
right,
patient-related executives nor the social workers. So I think we can inculcate
right,
those two areas where we can have a social worker where sympathy, empathy can be taken care of instead of having the
right,
counselors. I think social workers are the better persons who can act as a counselors as well. I think
right.
on the clock social work availability is useful not only into the OP cases areas, whereas those are required in the critical situations where there is a breaking bad news or taking up the critical situations where the patients are very bad and family members couldn't take it. Where some patients who are sick and they need sympathy and empathy as well. I think social workers would play a better role in keeping the wellness of the patients as well as the wellness of the other staff as well. I think that.
Right. This is very important. This is very important because otherwise, how many roles will a doctor play, or how many roles will an emergency physician play? You cannot do 10 people's job together. That is why we are experiencing the highest number of physician burnouts ever,
Yeah.
because we are exhausting ourselves doing things which are unnecessary, because there is so much of romanticized notion of a doctor, and we are expected to do so many things. We are expected to be the counselor, we are expected to speak to the family, we are expected to speak to the bystander, the patient. There's just too many things that we have to handle. And I think our own wellness is also something that we have to pay attention to. And therefore, when the team needs to be split, it needs to be split in such a way that all these efficient characters are also placed very well into the system.
Okay, I think that sounds great. Yeah. I think I have one question to you, Shruti. This is from
Right,
you as an emergency physician. How the emergency physician burnout can be controlled? What are the things they can do so that their burnout can be
right.
reduced?
Number one is be very, very strict about your timings. In the sense that as a physician, as an emergency physician, I don't think that we'll ever be able to do a 9 to 5 kind of a timing, but at least stretch it out to a week. In a week, if you're working for 48 hours, then make sure that you work only for 48 hours. Sleep tracking is something that is very, very important for people like emergency physicians who work within a system where we can never, guarantee continuous and regularized sleep cycles. Every probably quarterly, you need to give your physicians the kind of few days of break so that they can catch up on their sleep, they can reset their system. So that is also very, very important. Make sure that they have time, or make sure that you yourself have time to do the healthier things that you might do. It might be going on a walk, it might be going on a run, it might be working out, but things that are important for your own cardiac and other health conditions, you need to find the time for that. And if at all you're in a system where you are so swamped by work that you cannot find the time to rest, recuperate, recharge, restabilize, and come back, then you need to really, really question where you're at. Because what is the point in being a great physician with really bad health?
Yeah.
And what is the point if you are not in your optimal self? How will you deliver then? You will not be able to deliver. If you're constantly dealing with migraine pains, if you're constantly dealing with back pains, if you're at your absolute unhealthy worst, then you will not be able to have good emotional or good, psychologically good decision making skills will not be something that you'll be able to exercise. So keep these tabs. Make sure that every physician in your team goes through a certain checklist every quarterly at least. And make sure that they clock in certain things. In a week, how many hours of sleep are they getting? Is there a sleep deprivation pattern that you've been noticing? Keep their, at least check your vitals. How many of us physicians get our vitals checked? We don't do that. Unless and until we are sick and we are falling apart, we don't get our vitals checked. But keep track of these things. Just like how we punch in every morning and we punch out every evening, or beginning of duty and end of duty, keep a few vital trackers on point. That way you'll always be able to understand and provide any sort of mental health support within your hospital framework itself. So that intermittently they can. So I've seen that in the US, they have this mandatory 1 hour session every few months. This is just to assess if the physicians are at their best. And this is usually with a mental health practitioner. It could be the hospital psychiatrist, but it is something that needs to be clocked. Like they have a diary, or they have a system wherein after they finish that 1 hour of session, they have to write down and the other person has to sign off on it. If that is not done, it is a mandatory checklist that they haven't done, and they can be called by the management asking them why it hasn't been done.
That's great
So these
practice.
are all simple things that can be done. But yes, burnouts need to be handled, burnouts need to be controlled. If the whole healthcare system of a hospital needs to run, I think emergency physicians need to be at their absolute best.
Yes, I think that's an absolute. Uh, yeah, that's great.
All right. So then I guess we've talked enough. It's
Yeah,
already half an hour. Thank you so much, everybody, for your time. I do appreciate the fact that you have chosen to come and be here this evening. Yes, sorry about the technical glitches at the very beginning. I think most of us doctors, unfortunately, are not great with tech. I know I'm not. And it is one of the hiccups that happened because of that. But I'm glad that I could talk to you for this time. Feel free to connect with me via social media or via your LinkedIn. I'm quite active there. And if at all we can share notes and maybe do at least one something to make our healthcare system better, I'm all in. Thank you.
yeah, yeah. Thank you, Shruti, so much. And that's a great interactive session as such. Uh, so, just to summarize a bit, integrating the wellness and emergency physician is most important aspects. As an emergency physician, it's very important you work as a team. It's not only emergency physicians. You have emergency nurse, your emergency paramedics, your PREs, your social worker, your housekeeping staff. All comes into picture. There's not one, this is a one team. And whenever there's a resuscitation, ensure that you have a proper debriefing post your resuscitation, so that some of your team members can take it hard and they won't be able to work better. So just a quick 2 minutes debrief will help them out. And next important thing is your post every quarter. It's better to take a break for about a couple of days so that you relax yourselves and give a good proper sleep, have adequate time of good sleep. That will help you out in improving your health. And as she's absolutely pointed out, the vital check, which we don't do, we just hardly do an yearly, I think. It's better to everyday check. So our the weekly check, that would be more appropriate if you're unable to do daily check. It's better to monitor your vitals. As we burn out and stressed out, our vitals parameters are altered a bit, and most of the patients have hypertensives. So that's a research which is made, and it's better to check our vitals. But
Right.
okay, I think these are the most important take home points, and good food, not the junk food.
Good food.
Yeah. Yeah, on time. And then yes, take care of our patients. That's important
Yeah.
aspect. Yeah.
Yeah.
Thank you. I think we'll wind up the sessions now. Thank you so
Thank
much.
you.
Yep. See you all. Yep.